cases. Among the 274 confirmed cases, 147 were found in the quarantine areas. The others were screened out from the risky population. 150 used to be the asymptomatic areas. And judging from that, for the newly added positive cases, among the 5,396 asymptomatic carriers, 5,224 were found in the quarantine regions. 70 were found in the risky population through screening. By the end of May the 2nd, in the designated hospitals, there are 488 severe cases and 88 mild cases. The newly added death cases were 20. The average age is 83.9 years old. Those cases used to have some underlying diseases and late-stage tumors, including the metastatic diseases, for example, concerning the tumors in the nose and the cardiovascular disease, stroke, the hypertension and abnormal bleeding, Alzheimer, and the disease about the liver. One case used to be vaccinated. All the other death cases haven't been vaccinated. So the direct cause of death is usually the underlying diseases. And by the end of May the 3rd, we have screened 695,628 close contacts, all being in control. Yesterday, 3,981 were discharged from hospitals. 27,121 asymptomatic carriers will return to their neighborhood, so please get ready for their return. We have our focal points by different districts and different levels. For the 3 areas, we have a combination of antigen test and nucleic acid test. On May the 2nd, 13,819 areas belong to the contained areas. 22,300 are controlled areas. 5 million people live in the second category of area, and 15 million people live in the prevention areas. So please coordinate with our nucleic acid test and antigen test lasting from the 1st to the 7th of May. Thank you. Thank you, Mr. Zhao Dandan. Now we open the floor for questions and answers. And please identify yourself before raising the questions. Now let's begin. From line number 5. Thank you. From the CMG. My question is to the Municipal Health Commission. We have observed that for the recently discharged people from the makeshift hospitals, we see a lot of them. What are the detailed requirements for their stay-at-home quarantine after their return to the neighborhood? Thank you for the question. There is a rising number of people discharged from the hospitals. For the cured people who used to be positive, there will be 7 days of stay-at-home observation. There must be 2 temperature checks every day, and at the 7th day, there will be a nucleic acid test. Of course, they can receive the test by the medics paying visits, or they can take the dedicated vehicle to the stations for a test. While staying at home, they cannot step out of their house, and they must live in a single room and keep some distance from the family members. If they have cough or other symptoms, they must report to their community immediately. And if they are in instant need of medics, they must report. And while they are seeking medical help, they must put on their facial masks and take certain protective measures. And they will be transferred to the designated hospitals for further screening and confirmation. So, some information to the discharged people: while you are traveling back, you must pay attention to the disinfection of all your objects and yourself. After being discharged, for your belongings, including the clothing and the suitcase, there must be comprehensive disinfection. For electronics products, for example, computers and cell phones, you must use alcohol or the disinfection tissue to handle them and put them in a plastic bag. And your suitcase must be put in dedicated areas, and our staff will have disinfection over your suitcase. And you must wear the medical purpose facial mask in the whole traveling process and avoid talking to the other travelers. And when you get off board and return to your home, you must immediately take off your clothes and belongings and set them aside in the balconies for another round of disinfection. And you must use running water and soap to wash your hands. Thank you. Next question. From line number 17. Thank you. From the paper, my question is to Pudong District because we see a lot of demand for the delivery services. So as the management of the delivery men and their life guarantee, what are the measures taken? Thank you for your questions. Allow me to brief you the latest information. Speaking of the delivery men, they are important supporters of the city's operation. In Pudong District, there are about 7,000 delivery men every day. As to the management of the delivery services, we have done the following. First of all, on the e-commerce platform, they will be held accountable. We require the on-post delivery men to hold their electronic traveling pass, and there must be 3 tests every day, with 2 antigen tests and 1 nucleic acid test. Between 2 antigen tests, there must be at least 8 hours distance, and they must show their negative result when they are delivering services. And second of all, every day through our big data center, we will have confirmation of the nucleic acid test results of all the on-post delivery men. Without such a confirmation, we will trace them and forbid them to be on-post. So we will have instant feedback to this platform. Up until now, we haven't found any delivery man still running the service with a positive result. Third, there will be a spot check. The public security bureaus will take 20% of sampling to have a spot check over the pass or the test results of the delivery man. And also, the community service workers will also have a spot check over some particular points. Now, we don't find any illegal behaviors. And also, we will have comprehensive measures by working together with the communities. The village committees and neighborhood committees will have a local management measure. After entering into their neighborhood, they must scan the QR code, and they must wash their hands instantly before delivering the services to the civilians. In addition to the residence offered by enterprises, we also have 4 centralized settlements for the delivery men. We have an offering of 1,000 beds, and there are 39 nucleic acid test points and 6 mobile vehicles for the test. And we also have abundant antigen test tubes just for the dedicated services of the delivery men. Thank you. Next question. Line number 11. Thank you from Wenhuibao to Madam Huan. The community clinics must do treatment work in addition to the pandemic treatment. So what is the situation about those community service stations? Thank you for your concern about the community services during the pandemic period, especially in the contained areas. The medical services are in the hearts of all people, and our community health service center goes all out to pandemic prevention and control. In the quarantine areas and the contained areas, we have quick tests and quarantine measures in place, we have set up the family doctor mechanism to have regular guarantee of the medical needs. For example, the doctors dispatched to serve their duties and also the online counseling services. As to family doctors, they mainly target at those contained areas. Our team of family doctors will go through several channels to acquire information about the civilians' needs. Between different neighborhoods, we have established a dedicated WeChat account to help the residents to do the transfer, the referral work, or the prescription work, or the change of medications, and so on. And our medication team can guarantee that during the containment, the basic needs of medication of our residents can be met. The village committee and the neighborhood committee will handle the needs, and they must compare the list of medication with the needs of the residents. Based on that comparison, we will further replenish our list of medication. And they must give us such information immediately, and our pharmacy will prepare the medications, and the medications will be sent to the hands of the civilians as early as possible. For the online counseling team, they will respond to the questions raised by the civilians, especially about the health conditions. We have a health cloud and hotline. They can go through the two channels to take questions from the residents. For the questions unresolved online, we will also arrange offline services so that the online counseling and offline counseling and the cloud services will be in preparation for any safeguards. And for the heavy cases and severe symptoms, we can offer referral services for the patients. For the 322 people that fall into our prioritized population, we will pay special services to them. We will help to connect with the designated hospitals for the referral services so as to guarantee that the regular treatment cannot be stopped. And for the severe cases, we will offer instant counseling. They can contact with our hotline and our designated hospitals to meet their emergency needs. Up until the end of May the 2nd, in Gumei Clinical Center, we have offered for 143,000 errands for the civilians to help them prescribe their drugs. And in total, 382 people have been unposted for the services. We still have to do a lot of work, of course. In the future, we will continue to stay in the front line and work around the urgent needs of our civilians to protect their health and safety in the community level. Thank you. Next question. From line number 9.
谢谢主持人，我是中新社记者。
Thank you. From China News Service, my question is about the ambulance. The ambulances are under huge pressure. They have to refer the positive cases to the designated hospitals, and they are also responsible for transferring the heavy cases. So my question is for the ambulance resources, since it's in shortage, how can we relieve the pressure on the ambulances? And also for the medics support from the other provinces, they're coming to support Shanghai. They must have dispatched some ambulances and dedicated vehicles to be part of this force. So how is that going on? Thank you for the questions. We are surely in difficulty in terms of the emergency vehicles for the positive cases, their transportation and the transportation to the emergency rooms, the designated hospitals and makeshift hospitals, they are all on the shoulder of the ambulances. And the total needs of ambulances are 12 times more than last year, and they have to wait longer time for the ambulance to arrive. That's understandable. To that end, we are thinking about how to relieve the pressure on the ambulances by digging into our internal potential. We are also acquiring some new ambulances and asking for volunteers so that we can do our utmost to dispatch the resources. In addition, we have gotten the support from our sister provinces with the overall arrangement of the National Health Commission. Since April, coming from Tianjin and Henan, the teams have dispatched 100 ambulances and over 200 volunteers come to support Shanghai. They used to participate in similar pandemic prevention efforts. They have a lot of experience, and after arriving in Shanghai within the shortest time, they have put themselves all out, and there are 36 teams supporting the makeshift hospitals, and 14 are connecting with the designated hospitals. 50 vehicles are responsible for the closed-loop treatment. Within 5 days' time, the two teams have dispatched 500 times of vehicles, rescuing about 1,042 patients, greatly relieving the pressure on the hospitals and the ambulances. They have conquered a lot of difficulties, including the lack of mobility, and we are working closely together. So, to the sacrifices and support of our sister provinces and to the frontline workers, many sincere thanks to you. The last one question, please. Line number 15. From eastday.com, my question is to Mr. Yang. People are concerned about the dispatchment of the materials, especially in Pudong district. You started early, so how do you guarantee the necessity supplies? Thank you for the question. The life guarantee is at the hearts of all civilians. Pudong district has carried out the following 4 measures. First of all, we have expanded the acquisition scale. We work together with the supermarkets, convenience stores, pharmacies, and e-commerce platforms, asking them to open their stores as much as possible. Now, 987 supermarkets are open, 500 pharmacies are open, and 260 online e-commerce platforms are in operation. Second of all, we have a collective acquisition and dispatching. We are working together with Darenfa and other supermarkets, and the communities can collectively make the order, and then we will have collective transportation of the materials. And also, we have some mobile supermarkets so that the daily consumables and the medical materials could be sent to the doorsteps. And now, we have established 143 such mobile supermarkets. Third of all, we mobilize the neighborhood communities and property managers to come up with a list of the suppliers and improve the logistics. We are standardizing the community services, and also as to food safety and pricing, we will have some penalty measures if there are some illegal behaviors. And fourth, we will strengthen our distribution of the food and supervision of the food for the vulnerable people like the disabled and the elderly. We will deliver the services to their doorsteps, and we will have volunteers to come to their help. And we also have the categorized guarantee mechanism so that we can target at different groups respectively. Thank you. And that's the end of the Q&A session. We will brief you about the updates later on. If our media friends have more interview needs or questions, you could connect with the Municipal Health Commission or People's Government for more information. Thank you. That's the end of today's presser. Thank you.